So let's talk about the bilirubin metabolism. So the RBCs, which are old RBCs, senescent RBCs, the RBCs, they have a normal span of 120 days. So after 120 days, they break down. So they break down in the macrophages, and they break down into heme and globin part. So globin is the protein which will go to the protein pool of the body, and the heme, it will further change to biliverdin by the action of enzyme heme oxygenase. This biliverdin will reduce to bilirubin by action of another enzyme, biliverdin reductase. Now this bilirubin which is formed, it has to go to the liver, so it goes bound to the albumin. So there is a formation of bilirubin albumin complex. Now this bilirubin is the unconjugated bilirubin. It is bound to albumin, and it is not water soluble, but it is lipid soluble. But it is, since it is water insoluble, it is never excreted in the urine because it is bound to the albumin. It is not filtered across the glomerular filtration barrier, and it will not be seen in the urine. This is very commonly asked in the viva. Now this unconjugated bilirubin, now it has to undergo conjugation in the liver. So it will go to the liver, transported, bound to the albumin. This unconjugated bilirubin will be acted upon by enzyme UTP glucuronide transferase. It will form bilirubin monoglucuronide and diglucuronide, and this constitute the fraction of conjugated bilirubin. Now this conjugated bilirubin, it is water soluble, so it is easily excreted into the bile, and through the bile ducts this conjugated bilirubin will reach the intestines. Now conjugated bilirubin in the intestine, it is acted upon by the bacteria which are present in the gut, and there it is converted to urobilinogen, which is further converted to stercobilinogen. And this stercobilinogen, it comes in the feces, and it gives the yellowish brown color to the feces. So therefore in the conditions of obstructive jaundice, when there is obstruction to the bile flow into the intestine, in that case you get the clay colored stools or very pale stools, because at that time the stercobilinogen is not formed in the gut, so the stools become clay colored or pale colored. Now the urobilinogen which is formed, the 20% of it is reabsorbed into the blood, and out of that majority goes to the liver and forms part of the enterohepatic circulation. So it is reuptake by the liver, and about very small amount, about 2%, it goes to the kidney, and that urobilinogen, it is excreted into the urine. So trace amounts of urobilinogen can be seen normally in the urine. And the few important concepts which come after we analyze this metabolism. First, if there is a condition of prehepatic jaundice, that is when there is increased hemolysis, the RBCs, they are breaking down in large numbers, but liver is not able to conjugate all that RBC, and bilirubin is not able to conjugate in the liver. So in that case, the unconjugated bilirubin will rise in the blood, and liver will produce conjugated bilirubin to compensate for all the bilirubin unconjugated that is reaching the liver. So urobilinogen will increase in amount, and then it will be excreted in urine and feces. So we get dark colored stool and dark colored urine. So this is the first concept. So in the hemolytic jaundice, the urinary urobilinogen will increase, and urine and feces will be dark colored. Second concept is that in obstructive jaundice, as I told you earlier, the conjugated bilirubin is not able to reach the intestine. So there will no urobilinogen in the urine, and the feces, because of the lack of stercobilinogen, they will be pale or clay colored. This is another important concept and very important viva question also. And also the bilirubin, conjugated bilirubin, it increases in the blood because of the increased pressure. There is a bile duct obstruction, and because of the increased pressure, this conjugated bilirubin, it spill over to the blood, and in the blood conjugated bilirubin is increased. So in the urine, the bilirubin and the bile salts which are increased. So bilirubin and increased bile salts in urine will be seen in obstructive jaundice. In the hepatocellular jaundice, there is damage to the hepatocytes and there is limited, the capacity to conjugate is decreased for the liver. So in the urine, there is no bilirubin. Bilirubin will not be seen, and but urobilinogen may be seen because the small amounts they are formed in the intestine.